Hi, Dr. Yass here. In this video, I want to talk about the cause of chronic pain, and I'm going to provide this in a very unusual fashion. And what I'm going to discuss is something that typically is not discussed by anybody who follows the normal ways of looking at chronic pain and how to address it, and basically believes that the medical establishment has a good handle on things and there's no real reason for chronic pain, it just exists. I want to talk about the idea that chronic pain is not a medically based issue, it's a culturally based issue. I'm going to say it again. Chronic pain is not a medically based issue, it's a culturally based issue. So let me try to explain that, and then hopefully people will start to understand where I'm coming from this. So if you're to say that chronic pain is medically based, then it is to say that the way pain is diagnosed, which is primarily through the use of MRIs or X-rays, diagnostic tests, and a structural variation is identified, a herniated disc, stenosis, arthritis, a meniscal tear, a pinched nerve, a compression fracture, any of these things are found. And this is, in fact, the cause of the pain, the tissue with distress eliciting the pain. And all the attempts to resolve the distress of this tissue through all the different processes, including surgery, are accurate, but somehow, magically, you're still in pain, then that would imply that there's a medical cause. That, in fact, what's being done is highly accurate, and there's just some bizarre fashion, some bizarre reason, nobody's responding to this. 130 million Americans, 1 billion people worldwide. The diagnostic mechanism is exactly right. All the structural variations identified are causing the pain. All the treatments are exactly accurate, but the planet is simply not responding. So that's one view. We could think of that. But if you kind of look at the overwhelming evidence, you would actually see that, in fact, the cause of chronic pain is that it's cultural in nature. And that is to say that, in fact, the existing mechanism is, in fact, completely baseless, theoretically, clinically, and scientifically. And simply because there is a cultural acceptance that the MRI is accurate, you could ask most people and they're going to say, oh, arthritis causes pain, herniated disc causes pain, the finding of a pinched nerve or stenosis justifies it's the cause of pain. And so the mere fact that there is a cultural acceptance of this basically ends the attempt to get a more accurate diagnosis. So it is a cultural acceptance of this being accurate, not that it is by any means of understanding. There's no theoretical, clinical, or scientific evidence that shows that the MRI is accurate. In fact, it's based on correlative theory, junk science. It simply says that, oh, I have pain, I'm going to go to a doctor, they're going to get an MRI, and a structural variation is identified at the time I'm having my pain, therefore it is asserted to be the cause of the pain. That's called correlative theory, junk science. Here's an example. If I open my front door when the sun rises, I could say opening the front door causes the sun to rise. Lunacy, complete lunacy. Let's take it in another direction. The MRI will show at the time of your pain, you have two elbows. Therefore, I could assert having two elbows is the cause of your pain. Does anyone want to accept that as logical? Does anyone think that makes sense? Of course not, because it doesn't, because it's junk science. How about the fact that as many people with no pain have the same structural variations in the same percentages? Well, that certainly doesn't meet the scientific standard. If herniated disc cause pain, then those people without pain should not have herniated discs. I mean, this is all straight science, straight logic. The symptoms people experience are not where they should be if the identified structural variation would have caused pain. I'm constantly having this argument. Well, the doctor said that the herniated disc at the back is causing pain at the knee because it's referred. My hair is on fire, and it's on fire because the herniated disc is referring the fire. Anyone could say that. I mean, at some point, you have to start saying to yourself, does it make sense? And the evidence is overwhelming. It doesn't make sense. So therefore, the identification of structural variation is not the medical justification for what's causing your pain. It's exactly the opposite. It's not the proper way of diagnosing. And therefore, because it's simply over 40 years and the globe is doing it, is now culturally accepted as the best. So every person calls themselves their diagnosis. Every time someone reaches out to me, I'm an L12 herniation. I'm a stenosis at the L4. I'm a meniscal tear. I'm bone on bone at my hip. As if somehow that's it. That's the diagnosis. So that's who I am. And when everything fails, they're caught in a quandary. I don't understand why it doesn't work. I'm clearly bone on bone, but everything they do to make me not bone on bone doesn't make my pain go away. I mean, it's just so obvious at this point if you're willing to be open to the idea. So that's the question. That's why I posed this video. Are you willing to accept that the reason you're in pain is because there has been a cultural acceptance of a false premise? Or is it a medical issue that magically never resolves? You get to pick. It's your choice. I just present the information. I keep doing Zoom sessions with people and in-person sessions with people. I present facts. I follow the method that every tissue elicits a very specific set of symptoms, and to understand what tissue is in distress creating those symptoms, I interpret the very symptoms being experienced. It turns out in more than 98% of cases, the tissue in distress creating the symptoms is muscle. There are obvious indicators of that. The pain is only brought on by activity. When you sit down or lay down or rest, the pain goes away. The pain is actually being elicited in a muscle if you press on it. Even joint surface pain, like the knee joint around the kneecap, can be from altered muscle weakness or imbalance, causing misalignment of the kneecap in the joint. So even the pain in the joint can be muscular based. Muscles refer symptoms. Muscles can strain and impinge on nerves like sciatica. All of those muscular causes will never show up on a diagnostic test, and there's no medical specialty educated or trained to identify them. If you're willing to acknowledge that there's any chance in hell that the cause of your pain is muscle, you could pretty much guarantee that's never going to be diagnosed. Why? Because it doesn't fit the cultural parameters of what you should do when you're in pain, which is to go to a doctor, get an MRI, and whatever the MRI says, that's what I'm going to follow. How's it working out for the planet? You're 40 years into this, and now you've been forced to accept the idea that chronic pain is the equivalent of chronic illness. Complete lunacy. Those two things make no sense whatsoever. Chronic illness is a progressive degeneration of tissue due to a disease process. Chronic pain just means you haven't found the tissue in distress, eliciting the pain so you can resolve the distress of that tissue, thereby ending its need to elicit the pain. One has nothing to do with the other. But if you take the idea that your pain is medically based and you do all the medical things and you can't come to a resolution, then sure, of course you're going to accept chronic pain is relating to chronic illness. But if you start to see that the problem is cultural, that the actual use of the system is impeding you, it's impeding you from finding the actual medical cause, which is muscle in 98% of cases, then you have a chance. Then you have a chance to get a proper physical evaluation, which is at the core of the Yass method, and that will allow any tissue in distress, bone, muscle, or nerve, to be identified. And if it is muscle, which it is in 98% of cases, you could get the appropriate treatment. You could end the pain, end your dysfunction, and regain your life as you are entitled to have it. So the question is, and I'll ask the question again, just as I asked in the beginning, are you willing to accept that the reason you're still in pain is because chronic pain is a cultural phenomenon, not a medical issue? That's the question. You get to answer it. You just heard the preposition as to why I can prove irrefutably that chronic pain is cultural and not medical. And if you're willing to accept that, then seek the Yass method. That's the point here. That's what we're looking to do. The Yass method sits outside the medical system. It is a fitness-based program because in 98% of cases, the cause of pain is muscular. So if this sounds like something that piques your interest, if it's starting to make sense to you, you can contact me by email at drmitch@mitchellyass.com. Or if you decide you want to get a Yass Method Zoom session, you're any place outside of Jacksonville, Florida, and you want to get the method to help you evaluate your problems, establish whether it's muscle. If it is, you get to, I will present the exercises. You will perform them under my supervision. The sessions are videotaped. You get that videotape to make sure you're doing things correctly. We do every 2-week follow-ups until we reach the goal of being pain-free and fully functional. If that's the path you want to take, you can go to my website, livewithoutpains.com. It's plural, livewithoutpains.com/sessions, and schedule a session for the day and time that works for you. It's all up to you. I am an educator, first off. Second, I am a practitioner. My job is to make people aware of the issues that I've become aware of, that I've been given the gift of understanding, to recognize and to help people see and implement. So if that's the path you want to take, I just give you 2 ways to reach me or to set up a Zoom session for yourself. If you like this video and it makes sense to you, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I'm live on YouTube. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.